This is a first responder kit. In the top pocket you have everything you need for measuring vitals, including stethoscope, BGL kit, shears, people torch, temperature gauge, and an adult and child blood pressure cuffs. In the bottom front pocket, you've got your extra liquids, you've got PPE gear and sterile pads, sanitary pads, sorry. And paramedics can use this pocket to put their drugs in. The large side pocket is for hemorrhage control, which includes saline, 2 tourniquets, 2 different sized tapes, and multiple different sized bandages and gauze. There are also steri strips in there. On the other side, you've got your top side pocket, which contains anesthetic spray. You've got your spinal lanyard and sick bags. In the lower pocket is everything to do with glucose. So you've got your giving set, your needle and syringe, you've got glucose saline solution, a glucagon kit, and oral glucose. Inside, on the top, you've got your methoxyflurane, which is also known as green whistle, and you've got drugs for pain relief, including tramadol, ibuprofen, Panadol. In the next pocket down, you've got your biohazard bag, a laryngoscope and some lube. You've got your OPAs and your NPAs and your forceps. The next pocket down is the nebulizer and other oxygen masks, and you've also got your drugs that you can put in the nebulizer, as well as adrenaline and prednisone and salbutamol. Inside the bag, you've got your slidey sheets, you've got your sharp spin, and there's a LMA bag, and you've got your collar and your splint, and your child and adult bag of masks, as well as a towel, some saline solution, and IV giving set. Okay, this is a suction unit. To turn it on, you twist the dial all the way to full, and you listen for the sound. To test that the suction is working, occlude the tube, and the lights should go up, which means the suction pressure is increasing. And when you let go, they should drop back down. You can also test by placing the edge of the catheter on your hand and covering the hole at the top to feel and listen for suction. When using on a patient, you want the patient to be on their side, so if vomiting occurs, gravity can assist in taking it out. You only insert the catheter as far as you can see, and then you cover the hole and bring out the catheter in circular motions. You do not use on a patient for more than 10 seconds, and you only go as far as you can see because you don't want to cause any excess trauma. This could also induce vomiting. You do not use the rigid catheter on a moving ambulance because this could cause more trauma. There's also a soft catheter which you can use on babies, in the nose, or while the ambulance is moving. Okay, today I'm going to go over oxygen delivery. First, make sure you have an oxygen tank. You can check that by seeing that it's a white bottle with a black dial on top, and it will usually have a label that says oxygen on it. This is the oxygen regulator. On one side you've got the PSI gauge. To check that it's functional, you take out the Botox seal, have a look for any tears. This one has no tears, so I can replace it. If it is damaged in any way, you would hear oxygen escaping when you attach it to the bottle. To attach it, you plug in the pins on the regulator into the holes on the bottle. When you turn the oxygen on, the dial on the PSI gauge should increase to the green zone. If it's anything less than a quarter full, you would replace the bottle or refill. My bottle is empty though, so yeah. I'm going to attach a bag valve mask, making sure my bottle is lying down for safety purposes. Bag valve mask is used at a flow rate of at least 15, so I'm going to turn the dial to 50 minutes. Masks use different flow rates, such as the nebulizer, which uses a flow rate of 7 to 8 litres per minute. I'm going to ensure that my reservoir bag is full, otherwise I risk suffocating my patient. When I put the bag mask on the patient's face, I height place with a CE grip, which is 4-finger and thumb mask, and the rest of my fingers supporting the jaw to keep the airway open. Another grip you could use would be the two-handed grip, which is both thumbs on the mask, the rest of the fingers supporting that jaw again. When I deliver the oxygen, I squeeze the bag to 1/3 of the depth. You give oxygen patients with oxygen saturation levels of less than 94%. Issues with getting a good seal could be facial hair, facial trauma, or abnormal anatomy. When you are finished with the oxygen, you turn the flow rate down to 0, and then you take off whatever mask you have attached. Next, you would turn off the dial on the top, and then to bleed out the oxygen, you turn the flow rate back on. You would hear a hissing, which is all the oxygen releasing. Once that stops, you turn the flow rate back to 0. Today I'm going to go over how to use a Life Pack 12. So if you want to check the printer paper, the printer has paper in it. You would lift this tab up, open it up, and have a look inside. There is paper. To take it out to change the roll, you would just take it off the spindle that's in there. Shut that up. And on the back you've got your 2 batteries. To check that they're charged, you press the little grey button. I can see that these are both fully charged. If I wanted to change them out, I would push this little tab on the side and take the battery out and replace it like that. To turn it on, you press the on button. When you turn it on, its default mode is AED mode. So to take it out of AED mode, you would press advisory, use the selector knob to go across to yes, and select yes. Now I'm going to run a user test on it. So you press options, use the selector knob to go across to user test, and click yes. While that is running, I'm going to go through the side pockets. This pocket has all your diagnostic equipment. So you've got your end-tidal CO2, which measures CO2 that you expire. You've got your SpO2 sensor, which measures the percentage of oxygen attached to your blood. You've got your blood pressure cuff, also known as an NIBP, which is non-invasive blood pressure, and you would activate that by pressing the NIBP button. And you've also got your 3-lead ECG, which actually has 4 cables. On the other side, you have everything you would need for using the defib. So you've got your test load, you have your defib nodes. In this case, because I'm using a mannequin, normally they would have sticky pads to put on a person. And you've got your main cord. You also have some aspirin and a razor in here, as well as GTN, and you can usually find printer paper, spare printer paper in there. So I'm going to attach my ECG cords to my mannequin. For the purpose of this video, I have already attached the sticky nodes to the mannequin. You know where to put these cords because they say left leg, right arm, right leg, and left arm on them. My user test is finished, so I'm going to check that everything is all good. It says user test passed, so I'm going to put that to one side for now. Next, I'm going to do a test shock. So I plug in my test load and I select charge. This charges up to 360 joules, which is what you would use to shock an adult. Then you press shock, and the shock has been delivered. If you were to shock someone, but if you wanted to shock someone but then decided to actually cancel it, you would just push the selector knob and that would disarm it. Next, I'm going to attach my nodes to the defib and put them onto my mannequin. So you put one on the side of the rib cage and you put one on the sternum. These may fall off because there is no connecting nodes on the actual mannequin itself. To switch through the ECG leads, you would press lead and use the selector knob to go down to the 2, 1, and 3 and select that. If he had a heartbeat, you would see the lines showing up on the different levels. If you wanted to change the size of the waves, you would select size and then twist the dial to your chosen size. You can also adjust the heart rate volume or the QRS volume. So you go across to the top right of the screen, select with the select knob, then press it again and adjust the dial till you get your selected volume. To exit that, you can press home. You can also, to put it back into AED mode, you would press analyze and that switches it back to AED mode. We've arrived on scene where a 65-year-old male has collapsed. He appears not to be breathing and he looks pale. The scene looks safe with no obvious hazards, and we've got the stretcher parked nearby for ease of access. Holly, this could be a resus, so I'm going to get you to set up the defib and the suction unit for me, please. Alright. Hello, sir. Can you hear me, sir? My name's Maddie, and I'm here with my partner, Holly, today. We're from the ambulance. Can you tell me your name? No response to verbal stimulus. I'm going to try pain stimulus. Still no response to pain stimulus. I'm going to do a head tilt chin lift to check the airways. There are no obvious blockages in his airways. I'm going to put a towel under his head to support it and keep his airway open. Now I'm going to listen and feel for 10 seconds for any breaths. Okay, Holly, the patient's not breathing. Can you start compressions for me while I call for backup and start the defib? AUT to comms requesting R50 backup. I'm going to set up the bag valve mask while the defib is starting.
Analyzing heart rhythm. Do not touch the patient.
Thanks, Holly.
Shock advised. Charging. Stay clear of patient.
Nobody touching the patient.
Deliver shock now. Shock delivered. Pause.
Holly, start CPR when it tells you
Start
to, please.
CPR.
Thank you. I'm going to get an OPA and an NPA out. I'm going to insert the OPA. You're going to measure it from the corner of the mouth to the corner of the jaw. Insert upside down and rotate 180 degrees and push all the way in. You wouldn't use if the patient is seizing or has trismus or is conscious, because this could trigger the gag reflex and start him vomiting. Next, I'm going to insert an NPA, which you measure from the nose to the earlobe. Put some lube on it and insert perpendicular to the face into the largest nostril. If you have any trouble, give it a little wiggle and it should go in. You wouldn't use in the case of a TBI or a facial fracture, because this could cause further brain damage. Now I'm going to attach the bag valve mask to the oxygen and turn it on and put the flow rate to 15. Okay, Holly, can you count down from 5 for me? And when you get to 5, stop so I can give the patient some breaths.
5, 4, 3, 2, 1.
I'm going to deliver 2 breaths, squeezing a third of the depth of the bag. Alright, continue compressions. The bag valve mask is held on with a CE grip to get a good seal. Issues with getting a good seal could be if the patient has facial hair, damage to the face, or abnormal anatomy.
5, 4, 3, 2, 1.
Thank you, Holly. Keep it up. With chest compressions, we push to about a third of the depth of the patient's chest depth.
4, 3, 2, 1.
I'll switch with you soon, Holly.
Stop CPR.
Alright, I'll switch with you now. Thank you.
Analyzing heart rhythm.
Sorry.
Stay clear of patient.
Don't touch.
Analyzing heart rhythm. No shock advised. Pause. If
Can you
needed,
count my
start
compressions for me?
CPR.
And at 25, count down from 5 and deliver 2 breaths. Ma'am, did you see your husband collapse today?
Yes,
How long ago was this?
about 15 minutes.
Okay, what was he doing prior to the event?
He was just sitting watching TV.
Is there any medication we need to be aware of?
No,
1.
Has he had any events like this before?
not that I know of.
Okay, thank you. Any allergies we might need to be aware of?
Just hay fever.
Okay, thank you. We will continue CPR until either patient is revived or backup arrives.
5, 4, 3, 2, 1. Five, 4, 3, 2, 1.
Stop CPR.